I'm from Winnipeg, Manitoba in Canada, and I'm an impact-trained athletic trainer. I'm also a certified yoga instructor and have been since 2010. And what makes me unique in this field is that I've actually suffered my own concussion. So in the end of 2017, I was T-boned by a car on my bicycle. I had all this information. I was treating concussions. I was the first on the scene, on the field. And I just really wasn't prepared for the ripple effect through my entire life that it's kind of had. So I have lots of things to share with you guys. I completed my impact trained athletic trainer course after I sustained my own concussions. So with that, let's get started. Providing basic concussion information. So what is a concussion? I know I'm talking to medical care providers, so you guys know this. Concussion is the most common traumatic brain injury. A traumatic brain injury being caused by some sort of force, blow, trauma to the head. It might even be whiplash type injuries where the brain is shaking inside of the skull. So just any sort of moving force. It's going to cause short-term changes to mental status. So you might notice this representing in coordination, balance, even some personality changes right away. And definitions are constantly being updated. This is a relatively newer research field, so we're always learning more and more things about the brain. And every concussion is different. So you're not going to see a textbook set of symptoms the same for everybody. Everybody's different. Every brain is different. So every concussion is going to be a little different as well. Common causes of injuries. Typically, when you think concussion, I find most people tend to lean towards a sport type atmosphere, thinking football, contact, and hockey. However, the number one cause of concussions is actually falls. So that includes anybody, absolutely anybody. Winnipeg, this is where I'm from. Winters, we've got 9 months of slippery roads. People are falling, hitting their heads. That is, like I said, the number one cause of concussion. So they really can happen to anybody. Car accidents is another big one. Violence is one that doesn't always come to mind right away. But like I said, absolutely anybody can be at risk for a concussion. This is not just an athlete's injury. Prevention. I wish I had a wonderful trick to tell you all so you could tell your patients how to avoid and prevent concussions, but unfortunately there really is no one specific trick. Helmets are vital in helping protect skull fractures and maybe more serious injuries to the head and brain. But my best offer for you guys is to get educated, to tell your patients to be educated, to know what to look for, to know the risks, to know the signs, and to get baseline tested, which we'll talk a little bit more later on. So concussion symptoms, like I said, everyone is going to be a little bit different. So here are just some symptoms that you might recognize in your clients or yourself if you do sustain a head injury. Sensitivity to light and noise, dizziness, fogginess, lightheadedness, headaches are very common, nausea can come along with the dizziness, problems in concentration and memory. And these symptoms might not manifest right away. It can kind of pop up weeks or months later. So it's important to know and monitor your clients that have hit their head or sustained a whiplash injury. Additional signs, a little harder to measure, but still things to look out for. Change in behavior. If your client talks about sleeping way more or way less, talking about symptoms of anxiety, worrying and not quite sure what you're worrying about, decreased emotional control, vomiting, more dizziness, distractibility, and I find that concussion symptoms tend to be worse in the afternoon and into the evening. Think if you've kind of have your full cognitive batteries when you first wake up in the morning, as you're getting dressed, you're getting ready, you've found something to eat, you're using more and more and more of those energy reserves. And so by the end of the afternoon, the end of the day, your symptoms tend to be that much worse because you're that much more tired. Post-concussion syndrome, really important to touch on this. While most concussions are healed or resolved within 3 to 4 weeks. There's this 20% of patients that are going to have these symptoms linger on and on and on, sometimes years and years after the initial injury. And it's really important for you to know that this is a real syndrome that people are dealing with, and it affects absolutely every inch of their entire life. Going through my own rehabilitation, I had a medical care team write in their file that I was talking of post-concussion syndrome. Notice the air quotes there. That is not how you should be treating your clients. This is their life. Their pain is real. While we can't measure their symptoms, you have to take what their experience is through their words. And if they're continuing complaining of sensitivity to light, increased tiredness, headaches, we have to find the cause of that and try to help them the best we can, versus just pushing them to the side and telling them that their symptoms aren't real. All right, baseline testing. Why is it important? Like I said, we'd mention this later. Impact Applications has an amazing FDA cleared online baseline test. And why this is important is because it gives you, as the medical care professional, valuable data to be able to compare before and after head injuries or concussions. We can track brain function in its healthy state. And so after you've sustained a concussion, or your client has sustained a concussion, we can do those same memory, visual, spatial testing and have that data to compare side to side. This way, as we're creating a rehab plan, it can be so specific to your client's symptoms and their needs. It may also help in determining severity, although grading concussions isn't necessarily something that we're doing anymore. Diagnosing concussions. So the word diagnose is kind of a tricky word. There is no perfect test to 100% diagnose a concussion. The way I was trained was, if there is a mechanism of injury and they are presenting with a symptom, whether that's a little bit of dizziness, visual disturbances, or a headache, it's pretty sure that that client has sustained a concussion. They're not normally going to show up on CT scans or MRIs, although some emergency doctors will perform those tests just to make sure there isn't excessive swelling in the brain or there isn't more complications to be watching out for. But as the healthcare provider, you have to use a multiple of tools, testing balance through your interview skills, ocular, motor tracking. We'll talk more about the specifics later, but making sure you're using this holistic, well-rounded approach in order to find those symptoms and to diagnose a concussion as best we can. Okay, the expertise is crucial. The more you see, the easier it is to recognize. All right, let's dispel a couple concussion myths that I still hear floating around. Myth number one, we've already touched on, is that sports injuries are the main cause of concussion. We now know that is false, falls being the number one. You have to lose consciousness to get a concussion is another myth. More than 90% of concussions happen without a loss of consciousness. And so that'll sometimes represent as missing memories, or that might not even be there at all. Like I said, if you've hit your head and there is at least one symptom, it's likely you sustained a concussion or a mild traumatic brain injury. You shouldn't sleep after a concussion. Sleep can really help your brain post-injury. So this is also false. I know there's been parents that are going in and constantly waking up their kids after they've hit their head in a sporting event. We need to let those children rest, especially those 24 to 48 hours right after an injury. You may want to pop your head in, make sure the child or the adolescent is still breathing, but we don't need to be wrestling them up. We need to let them get the rest that they need, get the healing that they need. Resting in a dark room is the best way to recover from a concussion. Another myth, at least for long term, this 24 to 48 hour window that I keep mentioning, it might feel best to be in a cold, dark room. I know in my own personal experience, that was pretty much all that I could do the first couple of days after my head injury. But it is a gradual return to activity. The more we isolate our clients, the more we isolate ourselves, really, the harder it is to integrate back into life, into routine. So we do want to keep as much routine as normal life as possible from the beginning of the head injury, but that 48-hour rest, definitely, and then start to gradually return to activity and to learning from there as quickly as symptoms will allow. Myth number 5, our final one, it takes months to recover from a concussion. And while that's true for 10 to 20%, again, we're into that post-concussion syndrome, majority of people are well healed in 3 weeks or less, so about 80%. And so we don't need to necessarily scare everybody in thinking that concussions are lifelong debilitating injuries. While that might be true for some, it's not true for all. What to do after a head injury. So whether it's you or you educating your clients, you need to tell your patients to stop performing activity immediately. That is then going into, if you're allowing kids to continue to play, you're putting them at risk for a second impact right away, close from the first. There's so many complications down the road from there, including death potentially. So stop performing activity immediately. I cannot stress that enough. Then from there, 24 to 48 hours of rest. That means you're not going back into the game. You're done for the day. If you are an athlete, if this is a fall, I mean, do the best you can. Cognitive rest, that includes screen time. So going home and watching Netflix, unfortunately, does not count as rest. I know it's tough, but you got to find that brain power, the time to shut off and let it heal, let it rest. Seeking medical care to get a concussion evaluation, whether that's they're already coming to you, whether you're first on the scene, or whether you're generally educating your clients to not go at this alone. Find your medical team, find the care you need, get checked out, get it documented. Importance of reporting. So again, tell your coach, tell an AT, get your team together. If this is you, you as the medical care professional, you can be the point person. You can help your client gather all of the medical team that they need, find the resources that they need to get the absolute best care available. You want to encourage them to tell their family, tell their friends, helping them or making sure they have a support system, which is huge when you're dealing with an invisible illness such as brain injury or concussion. We want to make sure these people have the best chance to feel supported, they have the help that they need, because it affects absolutely every inch of your life. Things like laundry and cooking all of a sudden take more energy than you could possibly imagine. We want to make sure that our patients are connected and taken care of well beyond the hour or two that we are seeing them in our clinics. Checking in with the doctor as well if there are some red flags, which we'll touch on next. Here we are, danger signs. So if these things are representing in your patient or your client, these are sent to an emergency room for additional follow-up care. If you're checking their pupils, they're not equal, they're not dilating to light, they're just staying wide open, one's a little different than the other, big sign that there's a serious brain injury, send them to the doctor for extra tests. Convulsions, change in consciousness, and any of these symptoms that are starting to get worse with time, they don't seem to be getting better, headaches, weakness, vomiting, dizziness, deafness in ears, blindness in eyes, slurred speech, all of these things are going to be red flags for you to pursue additional care or to send your clients to the emergency room, like I said, for additional testing. All right, concussion treatment. So what you can tell your clients to expect and how you should be setting up your own treatment in your clinical practice. So here is my favorite fact. Concussions are treatable. So they're not a lifelong debilitating injury, although I'm sure some of us that are dealing with post-concussion syndrome definitely feel like they've changed us a little bit forever. Whether that's experience, whether that's brain injury, who's to know for sure? But concussions are treatable. The brain is being shown more and more in the research that it is able to heal itself. Neuroplasticity is an amazing, interesting thing to read up about. You can Google it. There's tons of research coming out all the time. But basically, our brain is constantly moving, it's healing, it's creating new neural pathways. We just have to give it the stimulus to prompt that. Okay, so current recommendations for concussion treatment right off the bat: complete cognitive and physical rest at 24 to 48 hours. Allow your body to settle. Give it the time it needs just to calm down. I find traumatic in the traumatic brain injury. It is, no matter how you've hit your head, it is a traumatic experience for the body, and it'll set your nervous system into more of a fight or flight. It'll be ramped up. Everything is working that much harder, and healing happens when we're able to settle, we're able to calm, to bring ourselves back. You feel that kind of dropping down. That's where the healing happens, and that's kind of the space that we've got to find our clients moving into so we can create the most beneficial change for them. Gradual return to activity from there as we're moderating symptoms. This is best done with you as the health care provider, helping them manage their symptoms, motivating them to know what they can work through and what they should be easing off on. Sometimes it's a scary place to know when you always have a headache, what you can be pushing through, what can you do a little bit more in, and what is causing more damage than healing. So you as the medical care provider need to help them along that journey. Objective tools to measure recovery is super beneficial, especially if you're working with any sort of insurance, or just to show that tangible data going forward for your clients that they are improving. Sometimes the steps are so small, it's hard to look back and realize how far you've really come over the weeks or the months, so that step by step, hey, last time we did this balance test, you fell out 4 times, today only twice. It's really good to have that data to compare. All right, your clinical evaluation. This is your clinical interview. We're going to do more talking than you think is necessary. You are going to ask more questions than you probably think are necessary, and your client's job is to complain the best they can. The more information that you can gather, the better. Also included in your evaluation should be some sort of neurocognitive testing. So the impact baseline test, ideally they have it before. Maybe we have the chance to do it again, so we have that data to compare. Vestibular ocular screening, so tracking eye movements, the vestibular system, the eyes, the visual. Balance testing, we're going to tap into that proprioception, and communication is key. So don't just take in all this information, form your own ideas, and not communicate them back to your clients. This should be a team atmosphere. The communication should be helping your client learn, and giving them the reasons why we're doing what we're doing, what we're testing, why we're testing, and just asking them every step of the way of how they're feeling. This evaluation can be a big ordeal for some. It's going to bring up symptoms. It's going to exacerbate their pain. So we've got to slowly integrate in and be mindful that these are, tough evaluations for those suffering with a brain injury. Okay, so during the interview, a couple tips for you to create the best environment for your clients, especially if you're wanting to specialize in concussion or brain injury. A couple things that you might not even realize are bothersome are your lights. If it is a bright fluorescent atmosphere, it's going to trigger some visual symptoms in some of your patients. If you can dim your lights, if you can soften your lights, that would be key. A quiet space, minimal distractions. We can close the door, have a private space, make it safe, allow your clients to speak to you one-on-one versus out in the open. I know so many clinics have 4 or 5 beds, just a curtain, the gym's in the background, guys are throwing weights. It's not the best environment to be doing this one-on-one clinical interview. So prep your environment as best you can for your clients. Allow for breaks as well. If you notice that they're getting very tired, very frustrated, their headache is getting worse, this might actually be an evaluation that needs to be split into 2 parts, or allow for some breaks, allow them to put their head down, have a little bit of water, whatever they need to make this, you know, not an enjoyable situation necessarily, but as close to as you possibly can, because this is part of their healing journey. We don't want to make it worse for them. Getting hit in the head is, you know, punishment enough, definitely. All right. Another thing actually is to make sure you've educated your clients and let them know that they may need a little bit of space and a little bit of time after the evaluation, that it is likely for them to have their symptoms get worse, and that you might not want to schedule 2 appointments in one day. Make sure you have the time to go home and rest after that initial evaluation. The computerized neurocognitive testing. So the impact baseline test, like I said before, hopefully they already have that information. If not, there are ways to average after. Not ideal, but definitely still worth testing in with the visual, the spatial, the memory tests that we can do online. Specific to your signs and symptoms. So there is a list where you'll go through and check what you're feeling and what you're not. And this is just one small piece of the puzzle that are going to give us more information so we can make the perfect rehab plan specific to our clients' needs. Another great way to show them along the way of how much they've improved. It'll, again, that tangible data that you can lay out directly in front of them. The vestibular ocular motor screening, or VOMS. So this is looking for any change of symptoms as we're going through this test. So it's a series of a couple different eye movements. We'll, you know, move side to side, not moving the head, just the eyes. We can look up and down. We can shake the head and try to keep the eyes steady on one point. It is important to be testing these vestibular ocular motor systems. It's going to give you, again, quite a bit of information as to where their deficits are and where we can kind of cater the rehab going forward. The balance error scoring system is another great clinical test. It'll be more into the proprioception, body awareness, their ability to hold themselves and know where they are in space. It's best when we've compared it to a baseline test that they had previous to injury. That's usually typical of athletes. They'll have that baseline test before the season. General public probably doesn't have access to that information. So you do the best you can with what you have. But definitely every error is going to be moving out of space, touching their toe down, waving more than kind of 30 degrees out of their center. These are all little things that we can, you know, keep track of and test and continue to test as we rehab and see the improvements. Multidisciplinary care. I wanted to touch on this because I know the ego is a real thing, and we want to be able to help our patients, and we want to know everything, and we want to be able to cover all of our bases and be this one-stop shop for our patients. But we got to be real and know that there is a whole team that can help us here. We need to know when we need to be referring out so our clients, our patients, have the absolute best access to the best care. A couple people that you should have within your medical team. Make these connections, have your network, know who you can refer out to, make it seamless for your clients. But the physician, especially if red flags are popping up for you, the emergency room, have a sports doc medicine doctor, an athletic trainer, typically on the field, typically your point person, neuropsychologist, psychologists. There is definitely an element of anxiety and mood. And as an athletic trainer, as a physical therapist, we have very little training. I mean, I took a sports psych class. I know a little bit, but I'm definitely referring out. It's so important. Again, that those invisible illnesses, we need to create this team, effective communication between everyone, making sure our clients are feeling seen and heard, especially if they're dealing with depression and anxiety type symptoms. An optometrist, if a lot of visual symptoms are coming up. Occupational therapists can be key in helping your client return back to work as well. If perhaps you don't have your own network, if you don't have these connections, you're looking for other concussion care providers in your area, check out concussioncareproviders.com. Impact Applications has this amazing website. It's gathering all of the concussion care providers in one beautiful area. So just type in your area, see everyone that's done some concussion care training, and create your network from there. All right, so I mentioned that no two concussions are the same, and obviously no one is the exact same. We're all little snowflakes living around. So the individual treatment, the rehab plan, this will come from all of this data from the interview, the eye screening, the balance testing, and then your client will fall within one of these 6 clinical trajectories. Either vestibular, you'll notice more kind of balance or proprioception difficulties. Ocular will manifest more in visual changes or visual differences. Cognitive fatigue, chronic tiredness, mental disturbances, memory changes, you'll find more in this trajectory. Post-traumatic migraine, there might be some symptoms that kind of Venn diagram over with post-traumatic syndrome or PTSD. This constant headache, more susceptible to migraines. So the sounds are loud, but so are the lights when you have this migraine. It's everything, it's debilitating, you're dizzy, and it's constant. Sometimes for people, this headache can go on for months and months and months. Cervical or cervical, I had 2 anatomy professors, they said it both ways. More manifesting into neck pain, neck dysfunction, loss of range of motion. Chances are that'll come with a tension headache as well. And then this final one of anxiety and mood. So those are persistent low mood type symptoms, constant anxiety with not necessarily a major reason behind the worries, just this hamster wheel of, you know, unending panic almost. All right, let's talk a little bit about returning to activity. So when you're clearing your patients, this is definitely a challenging task for your care team. You've gathered all this information. It is up to you to put it all together and make your best call here. We do the best we can until we know better, and then we do better. So hopefully over this webinar, you're learning a little bit more for your tools in regards for clearing your patients going forward. If injured, especially on the sports field, in the middle of a game, in the middle of a practice, that client, that athlete should not be returning to activity that same day. So again, we're tapping into those 24, 48 hours of rest, and then checking in with the testing, the symptoms. We want them to be symptom-free before we push them back into the game. So that day of no return to activity, we need to follow up with a healthcare provider for you. Returning to cognitive activity, not necessarily something that we're thinking of right away, especially as an athletic trainer. The focus was always on athletes and getting them back into sport, but chances are they're a student as well, or they're in school, they're learning. Just generally, if you're even working in an office and your concussion was from a fall, cognitive activity is getting back to be able to check your emails, make phone calls, be organized in your day. So this is really important to touch on. Schools, less than 50% of schools I've heard have a protocol to help kids return to learn or return to cognitive activity. So you as the medical care professional might end up being the point person to help the client navigate all the pieces of their life and help them return back as best they can. Students with a concussion probably won't be able to participate as normal. I think it's affecting every cognitive ability that we have. Attention, memory, focus, all these things are pretty key to learning. Regular schedule is important. So we want to keep routine as normal as we can along through the rehab, and missing school is doing more harm than good. So as soon as we're able to, we're integrating back. It might just be half days to start, but that is better than nothing. A couple things that we can educate our patients about helping to return to learn is making sure they're not making things harder for themselves. We can change the environment as best we can to support whatever symptoms that they're dealing with. If it's more light, if it's more sound, maybe we offer them earplugs to soften the noise, a hat to shade some of the light from their eyes, communication with the teachers. So if they are feeling tired, they are feeling overwhelmed, they're able to take more breaks. It might be as simple as letting the child put their head down at their desk, closing their eyes so they can, take away the visual cues, but just focus a little bit more on the auditory and drop into the learning rather than being distracted and pulling in every sort of direction. Another is allowing for more time for tests. Again, all of these little things can make a huge difference in supporting kids with concussions, adolescents, or if you're returning to work, same thing, communicating with your boss about supporting your environment to give you your best chance to keep going. The academic adjustments I just mentioned, the goal overall with all of those kind of little tricks, sunglasses, I prefer a hat over sunglasses, more breaks, more time. We're all just trying to minimize the time that's lost. So rather than staying home, waiting until you're 100% symptom free, we are integrating back a little bit sooner. We are trying to keep you connected, trying to minimize the time lost. Clear communication, I cannot stress this enough. This should be on every slide, between you, between your client, between educators, between supervisors, between the rest of the medical care team. If we can all be on the same page, if we can all speak together and use our expertise in different ways and different genres, we are doing the best for our clients. Well, less likely to miss key symptoms, and they'll be back that much sooner, ideally. Okay. Returning to physical activity, we can use these following steps as a gradual process in returning to activity. That 24 to 48 hour rest is first. Ideally, symptoms are starting to subside by then. We can start to integrate a little bit of activity, whether that's cognitive or physical, monitoring symptoms the entire time, keeping the symptoms limited, lower scale. We can say out of 10, if we're teetering into 5 out of 10, 6 out of 10, that might be too aggravating. And you'll be able to tell your clients, they'll know for sure the next day. So if they are super fatigued, hard to get out of bed, they feel like it's kind of drawn more symptoms out and they're feeling worse the next day, that's a really good indicator that you pushed much too hard the day before. So kind of work within your client's limits, but start to integrate activity as soon as you can. From there, we start to progress into light aerobic activity. So that might be a walk, whether they're outside or on a treadmill, but we're starting to get the heart rate back up into a steady state without symptoms being flared up too much. And we're always checking in. We're always trying to play in that balance. Athletes specifically, from there, they can work on the treadmill 30 minutes, no massive headache or excessive dizziness pops up or any of the other symptoms. From there, we can start to integrate some sport-specific exercise. So while if you're a hockey player, maybe that's strapping on your skates, going out for a skate, doing a couple non-contact drills, puck handling. If you're a football player, maybe it's testing sprints, maybe it's, getting on the ladder, trying some sport-specific moves. And once we've, started to integrate mostly into practice, we're still sitting out some drills, we're not contact, If we're monitoring our symptoms from there, we're feeling good, we can move on to more non-contact specific drills and then into integrating contact back in. Okay, in a controlled environment, contact, we're monitoring it, things seem to be okay. From there, back into full activity, back into games. Now this can take a totally different amount of time depending on your athletes. I'm not going to give you a guideline in regards to that, because I want you to be present with your clients. I want you to be present with your athletes, and depending on how they're feeling, the symptoms they're reporting is what's going to determine moving through these steps. Now, if you're not an athlete, maybe it's just return to play or a return to exercise, we can continue along these very similar steps. There just might not be any sport-specific exercise. Maybe contact isn't necessarily what you are trying to integrate back to, and then we just skip that step. Same thing. So this stepwise process, I mentioned heart rate, I mentioned symptoms. You want to be aware of both, you want to be tracking both. And this is where you can tell your clients that it's best for them to complain as much as they can. It mightn't seem like little things, it might not seem connected to them, but the more information you're taking in, the better your rehab plan going forward is going to be, the better care your client is going to get. So criteria for return to play is this symptom-free at rest to start, and then we'll be able to integrate the cognitive exertion. Maybe it's reading, maybe it's checking emails, it's not aggravating symptoms. We can then integrate some of that physical exertion as well, going for a walk, attending a yoga class, and again, still monitoring symptoms. Now, I do want to note that the post-concussion syndrome, those that fall into that category are still going to have symptoms, and their symptoms are likely going to be made worse with cognitive and physical exertion. I can tell you it's been about 1.5 years since my initial injury, and I can still feel when I've had too long of a day. If I've been learning, if I've been reading, I find that so much more taxing on my brain. If I'm learning new movement patterns, it's pretty much guaranteed that I'm going to be exhausted the next day. So be mindful of this idea of being completely symptom-free, but then, you know, bending those guidelines a little bit, because there are some clients that are always going to be representing with symptoms. And then we've got to find this line of, you know, we've got to push a little bit past that. We've got to move through the symptoms. We've got to interrupt that chronic pain cycle, and continue to add activity, cognitive and physical, where we can, when we can, with the hopes of, you know, stopping that pain spasm cycle or interrupting those pain signals that are getting strengthened as we're thinking about that pain day in and day out. I've been told by multiple people that, you know, it's kind of this, you'll feel a little bit worse before you feel a little bit better. Be mindful with that statement, but it is true. There is an element of pushing through some of your symptoms when you do live with post-concussion syndrome. Ideally, though, you're 80%, 3 weeks healed. We can wait the 48 hours, maybe a couple extra days before they're symptom-free, before we really push them, though. We want them to be within normal limits with their balance and their ocular testing, no excessive disturbances one way or the other before we push them back into their regular activities. And same with the neurocognitive tests. If we have that baseline, we want to see them as close to that baseline as possible before we're integrating cognitive and physical activity back in. So at-home exercises, you as the concussion care provider can recommend what is best for your patient to be doing at home. Because really, if we're seeing them just 1, 2, maybe 3 hours a week, that is a heck of a lot of hours outside of your clinic where they're left on their own. And that's a lot of missed opportunity for healing if we're not giving them homework to do at home. So light cardio as tolerated is a great exercise that you can offer them. Really simple. They can monitor their own symptoms. It can be a walk around the neighborhood. I like walking outside versus the treadmill. I find walking outside adds a little bit of, visual stimulation. So maybe you offer that, go out to a park, go for a walk, train your eyes to find movement, look for wildlife. You'll be looking side to side, training the cognitive and the physical at the same time. Meditation has been so vital in my own rehabilitation. I had mentioned that dropping into more of a parasympathetic nervous system state, as that's where the healing happens. Meditation is so good for that. It helps patients drop into the now, instead of worrying about the future, anxiety, or stressing about the past and why did this happen to me, or leading a little bit more into depression when we go there. Rather than if we can teach people to be here, drop into their bodies, find their breath, this is where we can build a little bit more of that resiliency, move forward with where we are right now. And that calming of the nervous system is really giving our bodies its best chance to create healing and to move forward in a stronger way. Gentle yoga. More and more research is coming out about yoga, and I love it. It's proven to do so many beneficial things, so many tied in specifically to concussion. We're going to be starting to improve memory, enhance attention, shifting into parasympathetic. We've got that healing going on there, the calming. It can go on and on and on. The gentle movement, really beneficial for the body as a whole. And it is this kind of both cognitive and physical, where we're learning these moves. We're maybe moving in a different way, in a gentle way, and we're learning to trust our bodies again. So, after a traumatic brain injury, the brain affects absolutely everything. We might have lost our, trust for what we can do, and what your client is feeling safe to move in their own body. And yoga can start to integrate, body and mind back together, and more of this holistic healing exercise. So prescribing gentle yoga doesn't have to be this big, elaborate sequence. I wanted to give you guys just a few simple poses that you can implement into your rehab plans right away. So you can't see my bottom half, but I'm just sitting in a simple cross-legged position on the ground. Your patient might be more comfortable on their knees, maybe some pillows propped up underneath them, but just sitting up with a tall spine, however, even in a chair, totally works. Okay, we're dropping down into the sit bones, and we're lengthening up as if I'm pulling you kind of up by the crown of your head. You'll sit nice and tall. And from that stability in the center line, we drop the ear to the shoulder. Just a really simple neck stretch. Okay, the way we adapt yoga for those with a traumatic brain injury or concussion is really just symptom dependent. So if your patient has a really big problem keeping their center of gravity, if they get really dizzy, if they get really nauseous, we'll move to the other side. You can advise them to keep their eyes open, to keep their gaze steady on a single point, and never to move into pain. These are just gentle movements. A little bit of sensation is good. Pain is your body telling you to back off. Okay, so after a simple neck stretch, you can always do neck rotations as well, moving slow, moving with breath. Seated cat-cow, we start to move more into the spine. So the inhale, we can pull the heart forward, the shoulders drop back. The exhale, we round in, belly in, chin tucks, and we move with breath. So inhale, we come forward. Yeah, exhale, we curl back. Specific eye exercises are great as well. Like I said, you can integrate them into everything. If it's the light cardio, you're looking around. If it's yoga, maybe you are moving the neck back and forth and you're shifting your gaze up and shifting your gaze down. Meditation, typically the eyes are closed, but you can do focused meditation where you're keeping your centered gaze on one point, helping with your attention. Or it might be, you know, you've got a poster on the wall and you're reading smaller and smaller font down the wall. There are so many different ways that you can integrate this into your rehab. If we're getting a little bit more active, we're getting a little bit more sport specific. Maybe your athletes are sprinting down a line and at the last moment you're going to tell them left or right, or red or green if you've got lights, or paddles with colors, just so you're adding that cognitive response where we're testing kind of both symptoms and we're creating new neural pathways, we're strengthening the brain, and we're rehabbing back in all ways. Importance of routine. So this is really crucial, especially in the beginning stages. It's so easy to fall completely off your routine, especially after concussion. You're so tired. I know this from personal experience. All I wanted to do was sleep all day and nap all day. But what ends up happening is that you rest in the middle of the day and it completely alters your sleep cycle. So then you're awake at night. And that's going to make it that much harder to integrate back into normal routine. And we do want to do that as quick as possible. So we want to make sure you're getting enough sleep, or your clients are getting enough sleep, but within a normal routine hours as best you can. There's nothing wrong with napping. Don't get it twisted. Napping is great, but a 4-hour nap in the middle of the day, which is disrupting your sleep at night, isn't best for rehabbing brain injuries. Hydration, obviously, one of the key factors to check in with and make sure your client is drinking that much water. We want to flush, you know, all the toxins out of the body. We want to support the systems with as much fluid as they need. And just, you know, any little thing that we can keep normalcy in our lives, integrating back into school as quickly as I can, integrating back into work as quickly as your clients can, but supporting within the environment, keeping the routine, but moving forward in a really kind way.